Hey, welcome to my channel. My name is Badass Benny, and if you're an ACE, AMAC, or sex human trafficking survivor, you're in the right place. And it won't cost you a penny to like and subscribe and share worldwide. And please leave a comment if you have any questions at the bottom there. And today we're going to talk about possibility of pregnancy. There was a rape for women, the possibility of pregnancy, and this is what happens. So they assess the risk of pregnancy after you've been sexually assaulted. Probabilities of conception from a single, random, unprotected intercourse is estimated to be between 2 and 4%. The probability of conception from a single, unprotected, mid-cycle intercourse, that means days 11 to 18, of a 20-day cycle of menses, is at least 10% and may be as high as 30% if the exposure was on the estimation day of ovulation. Other variables determine the probability of conception is also dependent on the usage of contraceptions, whatever contraceptions that you're using at the time, regularity of menstrual cycle, fertility of the patient and the alleged perpetrator, time in the cycle of the exposure, and whether the perpetrator ejaculated intravaginally. Baseline pregnancy tests are conducted at the time of the examination to determine if the patient was pregnant at the time of the assault or whether sexual abuse of a pubertal girl, a girl in puberty, resulted in pregnancy. If an existing pregnancy is a possibility, the results of the baseline pregnancy test should be received prior to prescribing estrogens or inserting an IUD to prevent pregnancy. So the pregnancy test is either blood, they either take it by blood in your arm or wherever they can get blood, or urine, which has a sensitivity of less than 50 it's called milli international units of HCG. The doctor will also discuss probability of pregnancy with you, given the different variables described above. Women of various ages, social, and religious backgrounds will have different feelings regarding the treatment options most acceptable to them. Major concerns include the patient's attitude toward conception and abortion and the desire to reduce the smallest risk of pregnancy as a result of a sexual assault. So the doctor is going to discuss with you all medically appropriate alternatives. There'll be like immediate treatment, it's called post-coital hormonal treatment or therapy. Post-coital insertion of a IUD device. There's copper 7s and copper Ts. They're no longer manufactured. Menstrual extraction before diagnosis of pregnancy. No immediate treatment, and patients decides to wait a minimum of 10 days to determine if conception did occur. So there's no pregnancy. The menstrual extraction performed within 2 weeks of the conception. There may be a therapeutic abortion. There may be some people choose continue pregnancy and refer patient to a family planning agency, adoption agency, or county department of social services. So either you're not pregnant, or your menses performed the 2 weeks of the conception didn't work, or you have to do it again. And some people get abortion, and some people decide to keep it. So that's what that is about. The hormonal treatment is recommended as a treatment of choice for post-coital hormone therapy. The Orval, ORVAL, contains 50 micrograms of ethinyl, I don't think I'm saying that right. It's Ethinyl, estradiol, and I'm sure that comes in a cream, and 0.5 micrograms of DLNORGESTREL. I don't know how to say that. Also, too, the recommended doses is 2 overall tablets within 72 hours of coitus and 2 additional tablets of 12 hours later. Absolute contradictions of oral contraceptives. So they're known or suspected carcinoma of the breast. You don't want, or you suspect estrogen-dependent neoplasia. If you have these symptoms, I wouldn't do the contraceptives. Undiagnosed abnormal genital bleeding, known or suspected pre-existing pregnancy, current or post thrombophlebitis or thrombotic metabolic disorder, cerebrovascular or coronary artery disease, benign or malignant hepatic neoplasia. Boy, howdy, that was a mouthful. Related contradictions of oral contraceptions. A decision about the use of post-coital contraceptive hormones in the context-related contradictions should be made based on all available clinical information. Hypertension, sickle cell disease, diabetes, congenital heart disease, liver disease. So those would be a contradiction of taking oral contraceptives. Read and discuss the consent form. The doctor's going to read this consent form with you, and they're going to need your signature. And they should have a sample of consent forms in English and Spanish. If the results of the baseline pregnancy tests are negative, start patient on appropriate dosages. And then they'll have the patient make an appointment for a repeat pregnancy test in 2 weeks at the hospital, physician's office, or clinic of her choice. There's Planned Parenthood, too. They're really good at Planned Parenthood. Patients should be advised not to have unprotected intercourse until the results of the second pregnancy test are available. Other options. If the patient decides upon one or the other option, schedule appointment time or provide referrals as appropriate. Now, what are you going to do to take care of yourself today?